Welcome to the Porecast. I'm your host, Carly Harmson. As a licensed master esthetician with nearly 2 decades of experience, I feel confident to meet you here every week to educate about the latest trends and must-have skin treatments, as well as to decode the science and demystify the overwhelming world of skincare. Whether you're a wide-eyed, curious beginner or you're a veteran skincare pro, this is the podcast for you. So grab your favorite face mask and come discover with me someone who's not only a skincare guru, but also a card-carrying member of Skincare Obsessed, just like you. Get ready for this episode of the podcast, starting now. Hello, welcome to the podcast. Many of you listening tune in each and every week, and I hope you look forward to Wednesdays just as much as I do. Whether you are new or returning, I hope you all had a nice, warm spring weekend with a beautiful holiday, a beautiful Mother's Day. I know that many of us celebrate this holiday as mothers ourselves or with our mothers, but I know it's not a joyous holiday for everyone. Those trying to conceive and struggling, those women that choose not to be a mom, or those that are grieving the loss of their mom. And so I like to treat Mother's Day more like a celebration of all women. And with the majority of my listeners being women, and the majority of the industry that I work in being female dominated, I just want you to know that I love being a part of the sisterhood and that I see you, I love you, I celebrate you, however you choose to observe or not observe the holiday this year. And in the spirit of that, today's episode will be focused on skincare for new mothers, specifically during pregnancy, and we'll talk a little bit about that postnatal period as well. If you find this topic triggering, please feel free to skip this one and go listen to one of my many other episodes that I hope you would find enjoyable and entertaining. And if you're not yourself pregnant, but perhaps you're a skincare pro that often treats skin of pregnant clients, then I hope you'll stick around, and I'm confident you'll learn something new today in this episode. As we head into this episode, it's important for me to share this disclaimer, which really applies to all of my episodes and other content that I share. And now I'm going to say the technical legal part right now. The information that's presented in this podcast is for educational and informational purposes only. It is not intended to substitute for professional medical advice, diagnosis, or treatment. So always seek the advice of your medical or healthcare provider with any questions that you may have regarding pregnancy or any other medical condition. Never disregard professional medical advice or delay in seeking it because of something you might have heard here on this podcast. I'm not a medical professional or a provider, and the information I'm providing is intended to educate, or what I like to call edutain. So again, please refer to your medical provider in regard to your own health and the health of your family. All right, I know that was important, needed to be said. And so with that stuff out of the way, let's jump right into it. Statistically, did you know the most common months to conceive are November through January? Talk about holiday cheer, am I right? That means that the peak pregnancy months are actually like right now through August, with many of you listening possibly being pregnant as we speak, or many of you skincare providers finding that it seems like something is in the water. You probably are finding that a lot of your clients are pregnant right now. And that's just statistically how it goes. So for many, this joyous time may have a mother-to-be radiating with that pregnancy glow. It's a tale as old as time. Perhaps she had struggled with skin issues before pregnancy and then noticed that they disappeared. Something like acne just magically disappears early on in pregnancy. This is totally not uncommon. Also not uncommon is a woman describing her skin as perfect. And then once she got pregnant, her skin drastically changes, and not for the better. Skincare is more important during pregnancy than ever, but there are some distinct issues and challenges in pregnancy, including new unique problems, as well as not having a full arsenal to treat, meaning The normally effective treatments we might use for acne or melasma, we can't always use or reach for. We will talk about that. So, some of the various skin issues during pregnancy that are most commonly seen are acne and melasma. As a master esthetician myself, I've seen this hundreds of times over a 20-year career. There are some definitive reasons for this, which we will explore. But the good news is a great skincare pro will definitely be able to help improve these conditions during and after pregnancy. Other issues that come up and arise during pregnancy might include stretch marks, probably most definitely include stretch marks, varicose veins, new skin tags, and new or changing moles. While stretch marks are to be expected when skin is vastly changing and stretching, preventing and treating the stretch marks during pregnancy is very difficult. While some new mamas swear by certain moisturizers, butters, or oils massaged onto the belly, or they swear by compression clothing to take off some pressure of the skin, there is no data that supports those as solutions. And in fact, there's no data that shows any science backed solution to preventing stretch marks in the first place. While a healthcare provider might suggest things like increasing water intake or trying to gain pregnancy more slowly and gradually, again, there's no known prevention. This would explain the statistic of 90% of women experiencing some degree of stretch marks from pregnancy, with risk factors including rapid weight gain. I just mentioned that. I think that I made it to like 36 weeks in my pregnancy without any stretch marks. And the few last weeks of my pregnancy, they exploded like the 4th of July. That was my attempt at a Jennifer Coolidge accent. Don't come at me. Anyway, there is a genetic predisposition, of course. If your mom had stretch marks, you probably will too in pregnancy, despite your best efforts. You know, I say it all the time, you got what your mama gave you. Other risk factors might include multiples in pregnancy, so like pregnancy with twins or triplets, and ethnicity. And despite what you might think, darker skin tones, which is more prone to things like pigment and melasma issues, are actually less prone to visible stretch marks. I'm not telling you this to discourage you if you yourself are pregnant or you're a skincare provider that doesn't feel like you have an answer or solution. I'm actually just sharing this, in fact, to normalize these skin changes because they will affect most of us. And if you didn't get stretch marks during pregnancy, consider yourself a unicorn, baby. You're special. Good news though, stretch marks can be treated after the fact and may reduce the appearance of those tiger stripes if you're looking to do that. Some people are wearing their tiger stripes in 2024 loud and proud, and I'm here for that too. At this time, at the time of this recorded episode, year of our Lord 2024, the most effective treatments of stretch marks include microneedling with PRP, that's plasma rich platelets, and various laser resurfacing or remodeling treatments. Chemical peels could be incorporated, but these three are going to be your top most effective treatments today. While they won't erase stretch marks, they can definitely improve the appearance of them. Important note though, the newer the stretch mark, the easier it is to treat. So my rule of thumb, while they're still pink, purple, or brown, once they heal, they tend to go a few shades lighter than the natural skin tone. And at that point, they become more difficult to treat. Who knows? In the future, there might be a treatment that comes onto the scene that is totally effective. And whoever creates that treatment or technology is going to be billionaire, because between that and hair loss, these are two of the most difficult cosmetic issues we face today. Regardless, treatment of stretch marks should be cleared by a medical provider, especially during the 4th trimester, aka the postnatal period, and definitely if mother is breastfeeding baby. Between the pregnancy hormones and increased blood flow as a result of those hormones, varicose veins, skin tags, and newer changing moles can definitely happen. With a few exceptions, like a certified laser tech / esthetician working under a doctor in a clinical setting, performing some laser maybe on some of these smaller, more superficial veins. Pretty much all of these conditions, including the larger veins, need and should only be treated by a dermatologist. So let's talk about the baby elephant in the room and the reason for so many of these skin concerns that come up. Those are hormones. Hormones. How about that? There is a symphony of surging hormones at conception through pregnancy and even continuing up to the first year after the baby is born. I want to point out a few of these important hormones and the role they play in skin health. And they are the big three sex hormones: progesterone, estrogen, and testosterone. In pregnancy, there is a surge of progesterone, which is responsible for protecting and developing the uterus, growing a placenta, and growth and development of the baby. And later on is responsible for lactation too. Particularly in the early weeks before the placenta is fully formed, progesterone is intensely increasing. Hello, morning sickness. That's the cause. Progesterone affects the skin health in many ways. It can both be partly responsible for that pregnancy glow and contribute to activating melanocyte activity. It may also help with hydration and moisture retention in the skin, but it can potentially cause blemishes too because it can cause a little buildup of dead skin cells, particularly around the hair follicle. Estrogen is also increasing during pregnancy for most, and estrogen is what I like to call the fountain of youth hormone. It can help a lot with moisture retention in the skin, leading to that really plump, youthful skin. It can also increase collagen and elastin production and increase blood flow, which just brings more life and radiance to the skin. In fact, estrogen is significantly responsible for that pregnancy glow that we see in expectant mothers. Also, with increased estrogen, it can decrease its antagonist, testosterone, which will slow oil activity and can clear the skin from blemishes during pregnancy for some. You might be wondering then, why is acne also a common skin issue during pregnancy? I mentioned in some cases progesterone can be the problem. But really, with the symphony of hormones, the ebb and flow, particularly of estrogen, these fluctuations can lead to little hits of testosterone throughout the pregnancy, although overall testosterone is decreased during pregnancy. So, this temporary surge of T can increase sebaceous activities and lead to those acne breakouts. Acne may be one of the biggest skin issues during pregnancy. While the body needs to follow its own hormonal journey during this time, meaning healthcare pros cannot and should not intervene or disrupt this process, we can help with the symptoms or results of this somewhat hormonal pandemonium. Stay tuned. I will share which treatments and ingredients are safe for pregnancy, as well as share some tips for pregnant clients in the spa or treatment room if you're a spa professional listening to the podcast today. The next most common skin challenge is melasma, aka pregnancy mask. This is characterized by pigmented patches along the cheeks or the bridge of nose, the forehead, and the upper lip. It forms or worsens during pregnancy and or through breastfeeding. This condition is challenging and it will take more time, likely beyond pregnancy and nursing, to improve, but it can be done and it helps when we know what causes it. The main cause of hormonally induced melasma is MSH, or melanocyte stimulating hormone. Melanocyte stimulating hormone, which can also be known as melanotropin, is a peptide hormone that plays a key role in regulating skin pigmentation and melanin synthesis. It is thought to increase during pregnancy and or breastfeeding due to progesterone increase. It can cause pregnancy mask in two ways: increasing melanin synthesis and supporting the melanin transfer via the melanosome. In addition to being stimulated by hormonal changes and fluctuations, yes, melasma happens outside of pregnancy, common with any that are starting, stopping, or changing birth control or certain HRT, hormonal replacement therapy. It's also stimulated by environmental factors like heat and UV exposure, exacerbating an already pigmented area. Interestingly, MSH from increased progesterone and sometimes a little estrogen may also be a contributor to the pregnancy phenomenon known as the the linea nigra. This is that pigmented line that forms usually during the second or third trimester. It looks like a line from the navel down to the pubic area. Normally, this line of pigment begins to fade immediately following birth and in the fourth trimester as hormones begin to level out. It usually doesn't require any type of skin treatment. It is my experience that melasma is much more stubborn and takes much longer to fade if it even does fade. It's usually going to require some treatment and intervention. And we'll talk about pregnancy safe skin brighteners in just a minute. Before we get into what we want to look for in ingredients and treatments during that very important special time, we're going to talk about the ingredients and treatments to avoid. So let's talk about ingredients first. The big one, vitamin A derivatives, retinoids. This includes retinol, retinaldehyde, and retinoic acid, commonly prescribed as tretinoin. It is known that vitamin A orally, for example, the treatment for Accutane, is highly toxic and known to absolutely lead to birth defects. I believe it is a standard of care to require monthly pregnancy tests and or birth control for female patients taking this drug because it can be incredibly serious to a developing fetus to be exposed in this high concentration of vitamin A internally. To a lesser degree, topical use of vitamin A should also be avoided as it is considered a risk with potential to systemic absorption and may be linked to things like miscarriages. Frankly, much like many of the next skincare ingredients I will share to avoid during pregnancy, it comes down to this: lack of safety data. For obvious ethical reasons, pregnancy is excluded from studies in these various treatments, which can help establish that important safety data. So, best to avoid these ingredients because we just don't know. Salicylic acid is the next ingredient to avoid, and salicylic acid could theoretically be really helpful in pregnancy because it's a great acne treatment, but should be avoided. It's known as a beta hydroxy acid, and this is because of its lipophilic nature. In large concentration, it can most certainly systemically be absorbed, and once an ingredient or drug is systemically absorbed, it moves through the blood and can possibly pass through the placenta to a developing baby. Speaking of drug, have you ever noticed that sometimes salicylic acid on a bottle or box or package is read on a drug fact label, and sometimes there is no drug fact label and it's just in a list of ingredients or found on the regular cosmetic ingredient listing? Let's talk about that. In the US, the FDA, that's the government agency, Food Drug Administration, that does regulate some cosmetic safety, requires a skincare brand or manufacturer to label a salicylic drug when it's at a therapeutic dose or higher. When it's at a therapeutic dose, if you will, which can potentially become systemic, hence the drug labeling. If you're a skincare professional or spa professional, do you know what that concentration or dose is? I would hope that you would, but unfortunately, ingredient knowledge and product chemistry isn't taught in the schools like it should be, so I don't know where else you would pick it up if you didn't learn it in school. The concentration of salicylic acid considered a drug is at 0.5%, that's half a percent, and above. It's common to see this ingredient in lower concentrations below 0.5% for its mild exfoliating and antimicrobial properties. But when it's considered a drug by the FDA, we know for sure that this ingredient should be avoided. So if you see the drug fact label on an acne product, avoid it through pregnancy and nursing. Another common acne ingredient, benzoyl peroxide, should also be avoided during pregnancy. This is another skin safety consideration. BP, especially at concentration higher than 5%, should be avoided. And while there might be exceptions, for example, a derm prescribing a pregnant patient this treatment for her maternal acne, over-the-counter treatments recommended by an SD or picked up at a drugstore is just not a good idea. Best to sit this one out, BP. Additionally, benzoyl peroxide, sal, and vitamin A derivatives all have the potential to irritate an already sensitized skin due to pregnancy. Next up, hydroquinone. Another, you guessed it, lack of safety data is the primary reason to avoid this really effective but controversial ingredient for pigment disorders like melasma. No one wants to volunteer themselves and their developing baby in the name of cosmetic science. And no one blames them, believe me. We just can't be sure this is safe. It is also thought to be a potentially systemically absorbed ingredient and also has been classified as pregnancy category C by the FDA, which means that animal studies have shown adverse effects on fetal development, but there are no adequate or well controlled studies in humans. While that risk of birth defects with hydroquinone is not established, it is generally recommended to avoid its use during pregnancy just as a precautionary measure. FYI, this category classification includes categories A, B, C, D, and X. A being the least amount of risk based on concluded studies, and X being positive evidence of fetal deformities in both animals and humans. Isotretinoin, aka Accutane, is categorized as a pregnancy category of X, just so you know how that works out. Okay, moving on. Due to increased blood flow, therefore increased sensitivity, certain chemical sun filters like avobenzone or oxybenzone could potentially be avoided during pregnancy, even though they don't have that full stop like the previous four ingredients I mentioned. If you or someone you provide skincare for has signs of increased sensitivity during pregnancy, perhaps look at a mineral only option, so a formula with zinc oxide and or titanium dioxide instead of one of the chemical sun filters. Finally, in skincare ingredients, the next category of ingredients should just be avoided during pregnancy and breastfeeding. And they may surprise you. They are actually essential oils. While there are many essential oils that would be considered harmless during pregnancy when they're diluted properly, there are many that are hazardous. So, in my humble opinion, best to avoid all around. And some of those essential oils include seemingly innocuous essential oils, things like cinnamon, rosemary, and thyme. These are problematic due to their emmenagogue. I hope I said that right. Emmenagogue effects, which may stimulate uterine contractions and lead to miscarriage or preterm labor. Please note, this is definitely not an exhaustive list, which is why I suggest avoiding them altogether. Important to know this too if you are a spa professional that uses aromatherapy in your spa or treatment room. Don't use or diffuse those oils. Speaking of spas, let's talk about the main treatments to avoid during pregnancy. The main treatments are treatments you are more likely to receive, or if you're a pro, perform in a clinical medical spa type of setting. So this includes some chemical peels, like the obvious one, salicylic acid, of course, but also peels like Jesner, TCA, or phenol peels. Also, high concentration peels of what we would consider generally safe, things like glycolic acid, but in a high concentration at like 30% or more, should be avoided as well. Laser treatments, like many of the ingredients and treatments out there, these should be avoided simply due to lack of safety data. But also with lasers, there is an additional concern of a potential of thermal damage due to pregnant patients' sensitivity to heat, which could cause harm as well as exacerbate a condition like melasma. There are also concerns of risk of fetal harm by potentially absorbing thermal energy into the bloodstream and passing that to a developing baby. Some I've heard use a rule of thumb: if you need to numb for it, you shouldn't do it while pregnant, while others, and my belief and philosophy would fall into this camp, better to err on the side of caution and just wait until after the baby comes. This includes modalities that fall under aesthetic lasers like radiofrequency, cryotherapy, cool sculpt, IPL, BBL, fractional or ablative laser like a CO2, and even laser hair removal. It is generally accepted to just avoid these treatments until a patient is no longer pregnant. I would be suspect of a clinic or med spa that was performing them. Very risky, big liability. Okay, finally in this category, injectables like neuromodulator, so Botox or filler like Juvederm. These are contraindicated for pregnancy and nursing because of ding 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 You got it, lack of safety data, as well as a theoretical risk of systemic absorption. It is being injected, so that makes sense. Better safe and crinkled than smooth and sorry. Outside of the clinical cosmetic environment, spa treatments or enhancements like long exposure to facial steam, steam rooms or saunas, hot soaks should be avoided as well to prevent the core temperature of mama increasing and negatively affecting the baby. Okay, so now we know all the things to avoid. Let's talk about what we actually can do during pregnancy. So, skincare ingredients and treatments to look for: retinoid alternatives. We'll talk about that first. Bakuchiol seems to be the most popular at the moment and may provide some benefits to aging skin, like increasing collagen and elastin production, thus reducing that appearance of fine lines and wrinkles. Can help out while you're not getting your Botox. Also, bakuchiol is a great antioxidant and can provide some hydration and has a lot of other benefits too. So that's a good one. For acne treatment, specifically acids that can be used to treat acne, I tend to reach for mandelic acid, which has been well studied to combat acne, is more tolerable than salicylic acid, and is safe for those little sensitive mamas to be. I also really like lactic and azelaic acid for not only exfoliation and potentially helping with acne, but also for treatment of melasma. They will not only exfoliate off those dead stained skin cells, but also they can help to reduce redness, they can hydrate the skin, and they may inhibit new pigment from forming. Other acne busting ingredients are ingredients like niacinamide, glycolic acid, and sulfur. And then some skin brighteners that might help with the melasma or help to fade dark spots include bearberry extract, licorice extract, kojic acid, arbutin, vitamin C, and my new favorite, tranexamic acid, but topical only, not recommending the supplement form. For professional treatments, really any kind of facial is appropriate. Hydrodermabrasion, like hydrofacial, could be really nice. LED light is considered safe. Manual extractions can be really helpful for the maternal acne. And then light chemical peels are appropriate for pregnant and nursing clients. With that being said, a few tips and special considerations for pregnant clients in the spa. If you're a pro, listen up. So, first and most importantly, I, as a skincare professional, will pass along the burden of approval of any skincare treatment or product I recommend to a pregnant client with her medical or healthcare provider. In other words, I may put a treatment plan together and strongly suggest that she run it by her provider before we continue. 99.99999% of the time, a healthcare provider would approve and maybe even laugh, but it's best to be on the safe side always. When proceeding with in spa or in clinic treatments, ensure there's plenty of time for breaks, for hydration, potty breaks, snack breaks. As anyone pregnant knows, especially in the later trimesters, baby can put pressure on the bladder, making the feeling to urgently urinate really strong and uncomfortable. Also, pregnant moms need snacks, so make sure you allow time, especially if they're doing multiple treatments at once. Be sure to help a pregnant client down and up from a facial table, bed, or chair. She may need extra assistance due to a difficulty in mobility. Also, coming up from a declined or supine position may affect the blood pressure more of a pregnant client. So, be sure to assist and ensure client feels well once in the safe seated position. Next, know that clients, due to increased blood flow, will be more sensitive and they also may be hyperreactive. So, a treatment or ingredient that never bothered your client before may irritate them just during pregnancy. This is not unheard of. So, perform treatments with less pressure, less intense temperature, and be wary of overly active treatments. Avoid excess heat in treatment. That means if you use lots of steam towels or use a bed warmer, to be conscious of that heat and perhaps skip it altogether, but for sure lower the temperature. Pregnant clients are at risk of overheating, which can cause stress to a baby in utero. Additionally, pregnant clients, specifically in the second and third trimesters, should not lie flat on their backs for any extended period of time, like during a facial. Weight of the growing uterus and baby compresses a large vein known as the inferior vena cava, which carries deoxygenated blood back to the heart. When this large vein is compressed, it can reduce blood flow to the heart and can cause a decrease in blood pressure, leading to symptoms like dizziness, lightheadedness, nausea, and a rapid heartbeat. This would be terrifying to have happen in your treatment room, so be sure to take care by offering breaks or propping up or bolstering up one side of your client's body or hip so your cute mommy is not at risk for an event like this. Last tip, but certainly not least, with the risk of skin issues like melasma, SPF is critical. Sun protection has to happen. There can be a phenomenon in pregnancy that can cause more sensitivity or even an allergic reaction to UV exposure. I was one such unlucky mom to be who developed solar urticaria. Yep, that is raised itchy hives during pregnancy. And unfortunately, I discovered this while on a vacation in Mexico. Ay caramba. Sunscreen, as well as coaching a client to avoid extended periods of sun and heat exposure, is wise. So, rash guards or sun shirts, not a bad idea, although I know they feel incredibly dorky. Okay, so I just spoke to the pros, and before we end today, I want to speak to nursing moms. The same rules almost totally apply while new moms are still breastfeeding. A couple other tips for breastfeeding moms. Due to a big drop of both progesterone and estrogen at and after birth, there may be some skin changes. The most common being extreme dryness. So, drinking lots of water, moisturizing regularly, and maybe even using a richer, more emollient moisturizer at night, a la maybe even slugging. I know that sounds shocking for me to say that, but it may help to mitigate that. And remember, estrogen being that fountain of youth hormone means that collagen and elastin synthesis will also drop from pregnancy to postnatal. So, supporting the skin with a quality peptide treatment, it's a good idea and it's considered safe for both pregnancy and nursing. If a gal didn't suffer from blemishes during pregnancy, she may find that due to the drop of pregnancy hormones, that testosterone increases and at last those breakouts come. Any of those acne fighting ingredients I mentioned earlier will help someone out. But once that new mom is no longer nursing or breastfeeding, she may move into some of those more classic acne ingredients like salicylic acid or benzoyl peroxide or retinol. Finally, during nursing, it's best to avoid fragrance in skincare and hygiene products. Babies are ultra sensitive even to the natural fragrances. And with a new mom loving and cuddling on her new baby, she may be unintentionally transferring some of those harsher chemicals onto baby's delicate skin. And for mamas who choose to bottle feed, really can resume any of these skincare products, ingredients, or treatments as soon as they're no longer pregnant and or nursing. Bear in mind that the hormones are still balancing out, remember, up to a year post-birth. So a new mom may find it helpful to allow that time before investing time and money into proceeding with some of these advanced treatments. All right, I hope this helps both mamas to be and my skincare pros treating one of our most common clients, and that is expectant mothers. Thank you so much for tuning in. I will see you next Wednesday as a new episode drops every Wednesday. As always, feel free to reach out. Let me know what you're thinking. Let me know if I missed anything. Let me know if you want to hear more about something. And have a beautiful week. Thanks for tuning into the podcast. If you liked this episode, be sure to share it with a bestie or on your socials. And if you love the episode, please leave a review wherever you get your podcasts. Your positive feedback means so much to me. You can connect with me at The Real Besthetician on Instagram or The Besthetician anywhere else. And hey babe, this week's podcast looks like clear with a chance of glow. See you next time.